Welcome to Costa Rica. My name is Johnny from Johnny Knows Costa Rica. Today we have the pleasure of being here in San Carlos in the hospital in San Carlos. Now, let me tell you a little bit about this hospital. This hospital on Saturday, couldn't even have planned it. It saved my life. My kidney stones were, oh my gosh. But you know what? Let's get into the interview because we have the pleasure of being with Dr. Carrillo here in San Carlos in the hospital. Dr. Carrillo?
Hello.
Hello. You know, the doctor is going to maybe talk a little bit English, maybe a little Spanish, whenever comfortable, but we're going to get some questions out. Doctor, thank you for...
Just a moment. Welcome to your hospital, San Carlos. Okay.
That is San Carlos for you.
Yeah.
It is Costa Rica welcoming you. Thank you, Doctor. Doctor, you know what? There's so much to ask, but today we're going to focus on 7 questions that a lot of people want to know about San Carlos. And they make it, you know, the Caja is so complicated and everything, but you know, I haven't had that experience. But Doctor, you know what? One of the questions that a lot of people have is San Carlos, it's growing so much, and there's a plan with the Caja that is a proposal for 2041. It's a program that you guys established that some normatives and things about how we're going to work with health in the future. Can you tell us a little bit about what San Carlos is doing and your role in that?
Okay, I go first in my Spanish, okay?
Yes.
Okay, creo que la población a nivel mundial y en Costa Rica también y en San Carlos también envejece. Entonces, lo que nosotros conocíamos antes como una pirámide poblacional, hoy se ha invertido. Entonces, hay más adultos mayores que antes. Antes se invertía mucho dinero en programas de atención a niños, adolescentes.
You know what? The doctor is talking about something that's close to my heart. Seniors, here in Costa Rica, there used to be a great focus on the younger generation, right?
Yeah.
And now it's been inverted to be the older generation. But doctor, please continue.
Okay, pues entonces ahora tenemos que ver las cosas diferente. Cuando tú vives más años, tienes más enfermedades diferentes, no transmisibles, hipertensión, diabetes, etc. Entonces tienes que invertir más dinero en en el manejo de esas enfermedades, en la prevención de esas enfermedades. Y eso tiene un costo mayor que el que tenía antes. Entonces, nuestro foco antes era niños y adultos adolescentes. Hoy son adultos mayores, más camas para adultos mayores, más medicamentos para adultos mayores y evidentemente cada año que pasa se tiene una expectativa de vida más grande, más amplia.
Here in Costa Rica, we are blessed to live a little bit longer. So what the doctor's talking about is that blessing comes with a cost. And they're working on to make sure that cost that's coming through is going to be addressed. Doctor, when you talk about the seniors, right now is how many seniors in the hospital are occupying the beds?
Maybe 60% of all hospitalization in the rooms. More than 60%.
In 2024?
Yeah, 2024, 2023, and before. Maybe in 2020 to ago.
Wow, that's an interesting statistic.
Yeah.
But what I'm glad about is that we're talking about the statistics, but the Caja's not sitting back and just, let me put my head down and just relax. You guys are addressing it. Mm-hmm. So that is something about Costa Rica that they're trying to address. Rome wasn't built in a day, so we got to work it little by little. Doctor, the next question that we have is that this hospital here, what level is this hospital in San Carlos in the ecosystem for the cajas throughout the country. I understand this is a regional hospital, correct? A regional hospital. This is
Yeah.
What is San Carlos's mission for regionally?
But this is important. The name of this hospital is San Carlos Hospital, but the hospital is not of San Carlos. We have a population of Zarcero, San Ramón, Huatuso, Los Chiles, Rio Cuarto. There's 1, 2, 3, 4, 5.
You have 14 districts, right?
Yeah. No, not only San Carlos.
Oh.
Okay?
So you also manage these other, so San Carlos has 14 districts.
Yeah.
But you also handle these other 5.
Yeah.
You know what? I didn't know that. Wow, you guys are really, you have a lot of responsibility.
Everybody, yeah. Everybody said this is the San Carlos Hospital. No, San Carlos. This hospital is of San Carlos. This is not true.
Really?
Yeah.
Wow.
It's only a name.
You know what? I have a question for you. We are close to Fortuna, which is one of the tourist destinations, a big tourist, a lot of things happen there. They're building, from what I understand, a level 1 clinic there. What is your synergy between the clinic in Fortuna and the San Carlos Hospital? How will that be? Will it be just like in Novaes? How is that?
Okay. Fortuna, Aguasarcas, Florencia, every clinic has already is first level. We have the second level. Second level is more important for the people.
Yes.
En palabras cristianas, tenemos más recursos.
You have more resources to be able to resolve.
Sí. Aquí hay especialidades, aquí hay quirófanos, aquí hay sala de partos. Tenemos a nivel nacional, somos el tercer hospital en mayor cantidad de partos que atiende en todo el país.
Wow.
Sí.
So you are the third hospital that has the most births in the country.
Yes.
Wow.
O sea que nosotros contribuimos con la natalidad del país. Y 30% de esos partos son de madres extranjeras.
So 30% of being born here are from foreigners.
Yeah.
Wow.
Yeah.
Doctor, the significance of San Carlos as a hospital in tourism and what goes on, what does that impact here? What do you see?
Creo que yo también he sido turista en algún momento. Y cuando viajo siempre quiero tener un buen seguro, que si me enfermo, tener un lugar adecuado. Aquí tuvimos, por ejemplo, al embajador de Canadá con un accidente de tránsito, se operó acá, fue a Florida y ahí le dijeron que había sido operado de manera excelente. Entonces, yo creo que para el turismo es muy importante saber que aquí tiene atención de primer nivel, no primer nivel de atención, de mundo desarrollado, de primer mundo.
So, something that the doctor just mentioned is that the ambassador of Canada was actually operated here, was taken care of because he had an accident in the area, and they let him know that when he got there that he was operated like it was in first world. This is a first world hospital with standards that are followed, which es algo de orgullo, ¿verdad?
Oh, yeah. Sí.
So it's something to be really proud of. Now, doctor, in society in Costa Rica, seniors are held at an upper bar here. And they're our treasure of our society here in Costa Rica. And you've talked about how the population is getting older, and what special programs do you have here in this particular hospital for seniors, for this up-and-coming community that's growing?
Ok, nosotros tenemos una especialidad que se llama geriatría y gerontología. Es básicamente para seniors.
Okay. Specifically for seniors.
We have three doctors in this specialty. Okay.
Okay.
And in algún momento, maybe next year or in 2 years, we have 20 or 30 bedrooms for
seniors.
For seniors.
Specifically
so
for
only
seniors.
Specific for seniors. Yes. But in this moment we have 10 or 15.
So you're going
bedrooms.
to double or triple the amount.
Ya. Y lo que estamos pensando también es porque estamos visualizando a futuro va a ser más necesario. Pero una cosa que es muy importante, y no sé si es bueno o malo lo que voy a decir, pero hay que hacer mucha conciencia a la gente que no abandone a los adultos mayores. Mucha gente los abandona.
You know, in Costa Rica in particular, seniors are taken care of. And something that he's specifically talking about is that the seniors that you have in your care, don't leave them alone. Don't just drop them off. They are human beings with dignity and should have that entire life. They laid the brick and the road that you land on today. Don't abandon them.
Yeah.
Doctor, lastly, in summary, all this, the hospital, we haven't touched the preventive health care. Right now, it's a lot of times it's reactive. We react, this hurts and I'm going to go fix it. Mm-hmm. The preventative health care, how does the hospital work with the devices to kind of bridge the gap between the two, to have that at the forefront? Because as I'm studying in Costa Rican healthcare, in the early 90s, from my research, Presidente Figueres, I believe, he took the devices away from Ministerio de Salud and gave it to the Caja. And the purpose at that time was, from what I hear, and you can correct me if I'm wrong, but was to promote and have preventive healthcare devices. But a lot of the seniors that talk to me, they say, well, when I go to the device, they refer me to the hospital.
Yeah. The first level is the prevent care is for the first level. The first level is clinical or device. El device es prevención, promoción, health education. Todos los tres programas son de primer nivel. Nosotros curamos lo que ellos no pueden curar. Sí tenemos algunas campañas de prevención, pero es muy poco porque tenemos que dedicarnos a la curación. ¿Qué es lo que hacemos cuando el paciente viene, se ingresa, se cura, se atiende, se cura y se va para la casa? Cuando va para la casa, nosotros le damos, we do everything for education. No queremos más que vuelva. ¿Ok? Te vas curado y educado. Pero solo cuando estás acá. Pero antes de eso no hacemos nada como ir a la comunidad.
Okay. I'm going to leave you with this last one. As a hospital, as a level 2 hospital, and what I understand the country has three national hospitals at level 3.
Yeah.
And then you have 6 hospitals, specialist hospitals at level 3. San Carlos is right here for me. What do we need for San Carlos to have a level 3 hospital?
Okay, many resources like oncology, resonancia magnética, laboratorio. We have 223 bedrooms in our hospital.
223.
Yeah, but I need more than 300.
You need 300.
Yeah. Todo eso como camas, como equipos, tecnología, especialistas como el que te digo, oncología, rheumatology, children's,
Children's wing?
No,
Pediatric.
pediatric, orthopedic, no sé, mucho más especializado.
More specialist. More
Yeah,
specialized.
More specialist. Yeah, sí, sí.
Okay. Well, we're going to make it our mission to try to help get the word out to that San Carlos is prepared to be a level 3 hospital.
But-
We have to help you get that, because so those of you guys that don't live in San Carlos, this is the people that really care about the community and want to do things, and the willingness to help the seniors to do this is you want to see it even more, because if there's so much talent now, imagine at a level 3.
Ya. A ver, siempre todo el mundo quiere empezar de poquito e ir a mucho, ¿ok? El sistema de salud per se en Costa Rica no tiene el poderío como para que todos los hospitales, a ver, todo pueblito quiere una clínica. El que ya tiene clínica quiere un hospital, y el que tiene un hospital quiere que sea regional o quiere que sea nacional, y eso es imposible. No hay sistema de salud que económicamente lo puede costear. Entonces, la gente tiene que tener claro que dentro del campo donde nos estamos, tenemos que desarrollar todo lo que podemos, pero no podemos llegar a tener un hospital nacional en cada cantón. Eso es una realidad.
Sí, no. For me, it's just that I see what you give to the community here, and we want the best, especially for this. And then when you mentioned that you have 5 other San Ramon and all these things,
Yeah.
you have all this responsibility. You know what? You guys are taking it on as a level, and not as a level 3, but taking on that responsibility. So we should help. But Doctor, thank you for taking the time today to share the beauties of San Carlos and the hospital itself. And do you have anything else that you'd like to say?
A ver, primero lo voy a decir en inglés, lo voy a decir en español. Yo estoy muy contento, muy feliz con que tenemos algo que mucha gente de la zona norte no lo sabe, te lo voy a contar. Tú eres sancarleño.
Right here.
En este momento, San Carlos es el mejor hospital regional del país.
Number 1.
Yes, the number 1. En listas de espera quirúrgica, la gente no espera tanto como en otros lados. Aquí 3 meses te operan, en otros lados te duran años y no te operan. Tenemos infraestructura de primer nivel. Todos nuestros pacientes en 223 camas tienen aire acondicionado. Todos. Wow. Tenemos baños de primer nivel para nuestros pacientes, que ellos dicen que son baños de aeropuerto. Hemos crecido con equipo médico maravilloso, tenemos equipo humano maravilloso, hacemos cirugías que solo en San José se hacen. Entonces, decirle a la gente que esto hay que quererlo, porque cuesta, todos los días nos cuesta y es de ellos. Entonces, pero sí que estén muy orgullosos porque tenemos el mejor hospital de todo el país a nivel regional.
I didn't know this, but the doctor's mentioning that this particular hospital regionally is the number 1 in the country. So if you're thinking about moving to Costa Rica, really think about moving to San Carlos. Having a hospital to be number 1 in the country is no easy task. Well, doctor, thank you for taking the time.
You're welcome.
Those of you thinking about living in Costa Rica, one of the things that you need to take in consideration is healthcare. And healthcare is a gift from above, but if you need the help, here in San Carlos, you're going to get it. Pura vida and always be safe.